Question 1. During a therapy session, you are collecting data on how long a child tantrums. Which type of measurement are you using? A. Frequency. B. Duration. C. Latency. D. Interval recording. Answer: B. Duration. This question asks about measuring the length of time a behavior occurs. The keyword "how long" is the main clue. Duration measurement is exactly what it sounds like, measuring the total amount of time a behavior happens from start to finish. Frequency is just counting how many times it happens. Latency is the time before it starts after a signal, and interval recording breaks time into blocks. If you're watching a tantrum and using a stopwatch to time how long it lasts, you're measuring its duration. Think of duration like timing a race. You measure how long it takes someone to finish. Here's an easy way to remember. Duration is about the length of the behavior. Question 2. Your client is learning to identify colors. You hold up a red card and say, "Touch red." This is an example of A. Reinforcement. B. Punishment. C. Discriminative stimulus. SD. D. Motivating operation. MO. Answer: C. Discriminative stimulus. SD. This question is about understanding what cues or signals tell a client that a certain behavior will lead to a specific outcome. The action of you holding up the card and saying "touch red" is the signal telling the client that if they touch the red card now, something specific will happen, like getting praise or a small treat, which is reinforcement. This signal is called a discriminative stimulus, or SD for short. It sets the occasion for a behavior to occur because that behavior has been reinforced in the presence of this stimulus before. Reinforcement and punishment are consequences after the behavior, and a motivating operation is something that changes how much the client wants the reinforcer. Think of an SD like a green light. It signals that it's time to go, and you'll get to your destination, which is like the reinforcement. Here's a simple tip. The SD is the instruction or cue you give the client. Question 3. Your client typically shouts answers in class. The behavior intervention plan states to praise the client when they raise their hand silently. This is an example of A. Differential reinforcement of other behavior. DRO. B. Differential reinforcement of alternative behavior. DRA. C. Extinction. D. Punishment. Answer: B. Differential reinforcement of alternative behavior, DRA. This question describes a strategy where you stop reinforcing the unwanted behavior, shouting out, and start reinforcing a different, more appropriate behavior, raising a hand silently, that serves the same function or is incompatible. This is called differential reinforcement of alternative behavior, DRA. You are differentiating, meaning treating differently, between the shouted answer and the raised hand, reinforcing only the desired alternative. DRO involves reinforcing any other behavior as long as the target problem behavior doesn't happen for a period of time. Extinction is simply stopping reinforcement for the problem behavior, and punishment is adding or removing something to decrease a behavior. Reinforcing a specific different behavior is the key to DRA. Think of it like teaching a child to ask politely instead of grabbing. You reinforce the asking, alternative, and don't reinforce the grabbing. Here's the takeaway. DRA is all about teaching and reinforcing a replacement behavior. Question 4. Which of the following is the most important aspect of implementing an extinction procedure? A. Pairing the behavior with punishment. B. Withholding all reinforcement for the target behavior. C. Providing reinforcement for a different behavior. D. Ignoring the client completely. Answer: B. Withholding all reinforcement for the target behavior. This question focuses on the core mechanism of extinction. Extinction is a procedure used to decrease a behavior by stopping the reinforcement that was previously maintaining it. The crucial part, highlighted by the word "most important," is making sure that every single time the target behavior occurs, it no longer gets whatever it was getting that kept it going. If even some instances are still reinforced, the behavior won't decrease effectively. Pairing with punishment isn't extinction. Providing reinforcement for other behaviors is part of other strategies, like DRA or DRO. And ignoring the client completely might not always be the correct response if the behavior was reinforced by something other than attention, like getting access to a toy. The absolute essential element of extinction is breaking the link between the behavior and its reward. Imagine a vending machine that used to give you a snack every time you put in money, but now it never does. Eventually, you'll stop putting money in. Here's the main point. Extinction is about cutting off the behavior's supply of reinforcement. Question 5. When writing session notes, it is best practice to A. Use subjective terms like the client was angry. B. Focus on observable behaviors like the client threw a toy. C. Include your personal opinions about the client's mood. D. Write about things the client might do in the future. Answer. B. Focus on observable behaviors like the client threw a toy. This question is about professional documentation standards for RBTs. When you write notes about a session, you need to be factual and objective, which means focusing on things you can actually see and hear, observable behaviors. Phrases like the client was angry are subjective because you can't directly see anger. You can only infer it based on behaviors like threw a toy, frowned, or shouted. Reporting what you saw threw a toy is objective and allows others reading the notes to understand exactly what happened. Your personal opinions or predictions are not appropriate for objective session notes. Stick to the facts. Think of yourself as a reporter describing exactly what happened, not interpreting why it happened. Here's the takeaway. Always describe what you see and hear, not what you think or feel the client was experiencing. Question 6. Which discontinuous measurement method records whether a behavior occurred at any point during an interval? A. Partial interval recording. B. Whole interval recording. C. Momentary time sampling. D. Frequency. Answer. A. Partial interval recording. This question tests your knowledge of different ways to measure behavior when you're not tracking every single instance or the exact duration. Discontinuous methods break time into intervals. Partial interval recording involves checking if the behavior happened at any point within that short interval. If it happens for even a second during the 1-minute interval, you mark it as occurring for that interval. Whole interval recording requires the behavior to happen for the entire duration of the interval. Momentary time sampling means you check if the behavior is happening exactly at the moment the interval ends. Frequency is continuous measurement, counting every instance. Partial interval recording is useful for behaviors that don't last long or happen frequently, and it often overestimates the true occurrence of the behavior. Think of it like marking if a child stood up at any point during a 5-minute check. Here's how to remember. Partial means even just a part of the interval with the behavior counts. Question 7. Your client typically asks for a snack by pointing to the pantry. Today, they say, "Snack, please." For the first time, you give them a snack and lots of praise. This is an example of A. Shaping. B. Prompting. C. Extinction. D. Punishment. Answer. A. Shaping. This question describes the process of shaping, which is used to teach a new behavior by reinforcing gradual steps or successive approximations toward the final desired behavior. The client is already pointing an approximation, and you are now reinforcing a closer approximation. Snack, please. You would continue to reinforce closer and closer requests until the client consistently uses the desired phrase or sentence. Prompting is giving hints or assistance. Extinction is stopping reinforcement, and punishment is decreasing behavior. Shaping involves reinforcing better and better versions of the behavior until you reach the goal. Think of teaching a baby to talk. You first reinforce sounds, then words, then sentences. Here's the tip. Shaping is like getting closer and closer to your goal behavior by reinforcing small steps. Question 8. A stimulus that signals the unavailability of reinforcement for a particular behavior is called a SD, discriminative stimulus, B, S delta, SD, C, reinforcer, D, punisher. Answer: B, S delta, SD. This question asks about a specific type of stimulus in ABA, one that tells the client that a behavior will not be reinforced in that situation, while an SD, discriminative stimulus, signals that reinforcement is available for a behavior, and S delta, SD, signals the opposite, that reinforcement is not available. If a child asks their mom for a cookie, behavior, and usually gets one, reinforcement, mom is the SD. If they ask their dad, SD, who never gives cookies, dad is the S delta for that behavior. Reinforcers and punishers are consequences that happen after the behavior. The S delta is a cue before the behavior. Think of a red light, SD, at an intersection. It signals that stepping on the gas, the behavior, will not get you through the intersection safely, reinforcement, and might even lead to a consequence, like an accident or ticket. Here's a simple way to remember. SD says, yes, reinforce, and S delta says, no, no reinforce. Question 9. An RBT's primary role is to A. Design behavior intervention plans. B. Conduct functional behavior assessments. C. Implement behavior plans developed by a supervisor. D. Provide clinical supervision to other RBTs. Answer: C. Implement behavior plans developed by a supervisor. This question defines the core responsibility of a registered behavior technician, RBT. RBTs are paraprofessionals who work under the supervision of a board-certified behavior analyst, BCBA, or board-certified assisted behavior analyst, BCABA. Their main job is to carry out the treatment plans that the supervisor creates. RBTs do not design intervention plans, conduct full functional behavior assessments, though they collect data for them or supervise other RBTs. They are the frontline staff who work directly with the client, putting the plan into action and collecting data. Think of the BCBA as the architect and the RBT as the builder who follows the blueprint. Here's the key takeaway. RBTs are the hands-on implementers of the behavior plan. Question 10. When preparing for a session, an RBT should review the client's behavior plan and previous session notes. This is important for A. Deciding if the client needs punishment. B. Understanding the goals, procedures, and progress. C. Changing the goals based on their opinion. D. Determining if the client is re-D for discharge. Answer: B. Understanding the goals, procedures, and progress. This question highlights the importance of preparation for an RBT session. Reviewing the plan and notes before starting is crucial for ensuring you know what you're supposed to work on, goals, how you are supposed to work on it, procedures, and how the client has been doing so far, progress. This helps you run the session correctly and consistently. You don't review notes to decide on punishment, change goals, that's the supervisor's role, or decide on discharge. Preparation ensures you are following the supervisor's instructions and providing effective treatment. It's like a teacher reviewing their lesson plan and student progress before class. Here's the tip. Always know the plan and the progress before you start working with the client. Question 11. Collecting data on the time between the end of one instance of a behavior and the beginning of the next instance of the same behavior is called A. Latency. B. Duration. C. Interresponse time, IRT. D. Frequency. Answer: C. Interresponse time, IRT. This question describes a specific type of time-based measurement. Interresponse time, IRT, is defined as the time that passes between two consecutive occurrences of the same behavior. Latency measures the time from a signal to the start of the behavior. Duration measures how long one instance of the behavior lasts. Frequency is just a count. IRT is useful for understanding the pacing of a behavior, like measuring the time between one bite of food and the next, or the time between one hand flap and the next. The key is it's the time between occurrences of the same behavior. Think of it as the pause button between one instance of the behavior and the next. Here's how to remember. IRT is the interval between responses. Question 12. Which ethical guideline requires RBTs to continue their education and training throughout their career? A. Responsible conduct. B. Confidentiality. C. Maintaining competence. D. Professional boundaries. Answer: C. Maintaining competence. This question asks about the ethical responsibility related to staying skilled and knowledgeable in your field. The ethical code for behavior analysts, including RBTs, emphasizes the importance of maintaining competence. This means you are required to stay up to date with current practices, attend training, and seek ongoing education to ensure you are providing the best possible service to clients. Responsible conduct is a broader category. Confidentiality is about protecting client information. Professional boundaries are about keeping your relationship with clients professional, not personal. Staying current in your skills falls specifically under maintaining competence. Think of any licensed profession. Doctors, teachers, they all have to keep learning to maintain their license and provide good service. Here's the takeaway. Maintaining competence means always learning and growing in your job. Question 13. A type of prompting where you guide the client's hand or body through the desired movement is called A. Gestural prompt. B. Verbal prompt. C. Full physical prompt. D. Model prompt. Answer: C. Full physical prompt. This question is about different ways to help a client perform a behavior, specifically using physical touch. A full physical prompt involves the therapist completely guiding the client's body to perform the action. For example, if teaching hand washing, you might take the child's hand and guide it to turn on the water, grab the soap, and rub. A gestural prompt is pointing. A verbal prompt is giving an instruction or hint, and a model prompt is showing the client how to do it. Full physical is the most intrusive type of prompt because it provides the most assistance. Think of teaching a child to write their name by holding their hand and guiding the pencil for the whole word. Here's the tip. Physical prompts involve using touch to help the client. Question 14. Your client typically engages in screaming behavior when asked to clean up. The BCBA suggests having the client clean up small amounts at a time, gradually increasing the amount. This is an example of A. Extinction. B. Punishment. C. Task analysis. D. Shaping. Answer: D. Shaping. This question describes a strategy that involves gradually introducing the demand or task in small, manageable steps and reinforcing compliance at each step, slowly getting closer to the full, difficult task. While task analysis breaks down a task into steps, this scenario is about using those steps to gradually increase the demand to make the client more tolerant and reduce the problem behavior related to the demand. This gradual increase in difficulty or demand, reinforcing successful approximations to the final goal, cleaning the whole mess, is a form of shaping or demand fading, often used to decrease avoidance behaviors. Extinction stops reinforcement, punishment adds a consequence to decrease behavior, and task analysis is just breaking down the steps, not the process of gradually introducing them. The core idea here is reinforcing closer approximations to the full cleanup, making it shaping. Think of getting used to cold water. You might dip your toes first, then your ankles, then wade in slowly, reinforcing, or finding it okay. At each step until you can jump in. Here's the takeaway. Shaping can be used to build tolerance for difficult tasks by starting small and gradually increasing the challenge. Question 15. When a behavior briefly reappears after it has been decreased or stopped completely through extinction, this is called A. Extinction burst. B. Spontaneous recovery. C. Punishment. D. Generalization. Answer: B. Spontaneous recovery. This question describes a common phenomenon that can happen after a behavior has been put on extinction. Spontaneous recovery is the sudden reappearance of the extinguished behavior after some time has passed without it occurring, even though it hasn't been reinforced. It's usually temporary and less intense than before extinction. An extinction burst is a temporary increase in the behavior, and sometimes new behaviors, right after extinction starts. Punishment decreases behavior through consequences. Generalization is the behavior happening in new situations or with new people. Spontaneous recovery is like your old bad habit popping up again out of the blue after you thought you got rid of it, even though you haven't done it in a while. Here's the tip. Spontaneous recovery is when the behavior makes a surprise comeback after extinction, like a ghost from the past. Question 16. You are teaching a client to wash their hands. You have a list of steps. 1. Turn on water. 2. Wet hands. 3. Get soap, etc. This list is called A. Behavior intervention plan. B. Task analysis. C. Skill acquisition plan. D. Preference assessment. Answer. B. Task analysis. This question asks about breaking down a complex skill into smaller, manageable steps. A task analysis is exactly that, taking a skill like hand washing and breaking it down into a sequence of individual steps that can be taught one at a time. A behavior intervention plan focuses on decreasing problem behaviors. A skill acquisition plan outlines goals and procedures for teaching various skills, and a task analysis is often part of a skill acquisition plan for complex skills. A preference assessment finds out what a client likes. Breaking a skill into a numbered list of steps is the definition of a task analysis. Think of following a recipe. It breaks down cooking into steps. Here's the takeaway. A task analysis breaks a big skill into little pieces, so it's easier to teach and learn. Question 17. If a client is engaging in a dangerous behavior, such as headbanging, while you are implementing an extinction procedure, what should you do? A. Continue the extinction procedure as planned to avoid reinforcing the behavior. B. Immediately stop the procedure and ensure the client's safety. C. Reinforce the dangerous behavior to stop it quickly. D. Ignore the behavior completely. Answer. B. Immediately stop the procedure and ensure the client's safety. This question is about ethical responsibility and client safety during intervention. While consistency is important in ABA, client safety always comes first. If a behavior becomes dangerous during an extinction procedure, which can sometimes cause an extinction burst, potentially increasing the behavior before it decreases, you must prioritize the client's well-being. This means stopping the procedure if continuing it puts the client at risk and taking steps to ensure safety, then communicating with your supervisor about the situation. You would never reinforce a dangerous behavior or simply ignore a behavior that could cause harm. Safety is the absolute top priority. Think of if you were teaching a child to walk and they started falling down stairs. You'd stop teaching and prevent the fall. Here's the crucial point. Client safety overrides all other aspects of the behavior plan, including the consistent implementation of a procedure like extinction. Question 18. Reinforcing the first instance of a behavior after a specific amount of time has passed, regardless of how many times the behavior occurred during that time, is what type of reinforcement schedule? A. Fixed ratio, FR. B. Variable ratio, VR. C. Fixed interval, FI. D. Variable interval, VI. Answer. C. Fixed interval, FI. This question tests your understanding of different schedules of reinforcement. The key here is that reinforcement is available after a fixed set amount of time has gone by, and the first time the behavior occurs after that time has passed is the one that gets reinforced. Fixed means the time is predictable. Interval means it's based on time, not the number of behaviors. Ratio schedules are based on the number of responses. Variable schedules mean the time or number changes unpredictably. An example of FI is getting paid every 2 weeks, reinforcement, regardless of how much work you did within that 2 weeks, as long as you did some work, the first behavior after the time is up. The behavior rate on FI schedules often increases right before the end of the interval, like studying more right before a weekly quiz. Here's the tip. Fixed interval means reinforcement is time-based and predictable. Question 19. You are teaching a client to wave. You stand behind them and gently move their hand in a waving motion. This is an example of A. Verbal prompt. B. Model prompt. C. Physical prompt. D. Gestural prompt. Answer: C. Physical prompt. This question is similar to an earlier one, but focuses specifically on using touch to guide the behavior. Moving the client's hand directly is using physical contact to help them perform the action. This falls under the category of a physical prompt. A verbal prompt uses words, a model prompt shows the behavior, and a gestural prompt uses pointing or other body language. Guiding their hand is a clear use of physical prompting. Think of teaching someone a dance move by taking their hand and moving it with yours. Here's the reminder. Physical prompts involve using your body to help the client's body move correctly. Question 20. Which of the following best describes the process of collecting data on a behavior? A. Guessing how many times the behavior occurred. B. Subjectively describing the behavior in detail. C. Objectively measuring and recording the occurrence of the behavior. D. Only recording the behavior when it is problematic. Answer: C. Objectively measuring and recording the occurrence of the behavior. This question is about the fundamental principle of data collection in ABA. Data collection must be objective, meaning it is based on factual, observable information, not guesses or opinions. Subjective. You need to measure the behavior using a defined method, like frequency, duration, etc., and accurately record what you observe. You shouldn't guess, rely on subjective descriptions without measurement, or only record the behavior, sometimes if the plan requires continuous data or specific intervals. Good data is crucial for tracking progress and making decisions, and it must be based on objective measurement. Think of a scientist recording results in an experiment. They meticulously measure and record. They don't just guess or describe feelings. Here's the takeaway. Data in ABA is all about objective facts, measuring what you see and hear. Question 21. You are trying to figure out why a behavior is happening by observing when and where it occurs, what happens right before it, and what happens right after it. This process is most closely related to A. Preference assessment. B. Skills assessment. C. Functional behavior assessment, FBA. D. Curriculum development. Answer: C. Functional behavior assessment, FBA. This question describes the core components of a functional behavior assessment, FBA. An FBA is a process used to identify the function, the why, of a behavior by looking at the environment surrounding it. This typically involves collecting information about the antecedents, what happens before the behavior, and consequences, what happens after the behavior, to understand what triggers and maintains it. This approach is often called ABC data collection. Antecedent behavior consequence. Preference assessments find out what motivates a client, skills assessments check what skills a client has, and curriculum development is creating teaching programs. Determining why a behavior is happening by looking at what precedes and follows it is the essence of an FBA. Think of solving a mystery. You look for clues, antecedents, and consequences to understand the motive, function behind the action, behavior. Here's the tip. FBA is about figuring out the purpose or function of a behavior. Question 22. A schedule of reinforcement where reinforcement is delivered after an unpredictable number of responses is called A. Fixed ratio, FR. B. Variable ratio, VR. C. Fixed interval, FI. D. Variable interval, VI. Answer: B. Variable ratio, VR. This question asks about a specific type of reinforcement schedule where the number of responses required for reinforcement changes from one reinforcement to the next. Variable means unpredictable or changing. Ratio means it's based on the number of responses. Fixed means predictable. Interval means based on time. Variable ratio schedules produce high, steady rates of behavior because the client never knows exactly which response will be the one that gets the reinforcement, so they keep responding. Gambling is a classic example of VR. You never know how many times you have to play, respondee, before you win, get reinforced. Here's how to remember. Variable ratio means the number of behaviors needed changes unpredictably. Question 23. When a client's problem behavior increases significantly in frequency or intensity immediately after an extinction procedure is implemented, this is known as A. Spontaneous recovery, B. Generalization, C. Extinction burst, D. Punishment. Answer C. Extinction burst. This question describes a common temporary side effect that can happen when you first stop reinforcing a behavior. An extinction burst is that initial, often frustrating, increase in the behavior, and sometimes new related behaviors like crying harder or trying new ways to get the reinforcement. Right after you start the extinction procedure, it's like the client is trying harder to get the reinforcement that used to work. Spontaneous recovery is the behavior popping up again later after it had decreased. Generalization is the behavior happening in new places. Punishment decreases behavior immediately. Knowing about extinction bursts is important so you don't give up on the procedure too soon, as it's often a sign that it's starting to work. Think of a child pushing a button that always gave cookies. If it stops working, they might push it faster, harder, and repeatedly before giving up. Here's the takeaway. An extinction burst is a temporary spike in the behavior when you first start ignoring it or stopping its reinforcement. Question 24. Which prompt type is generally considered the least intrusive? A. Full physical prompt. B. Partial physical prompt. C. Verbal prompt. D. Gestural prompt. Answer D. Gestural prompt. This question is about prompt hierarchies and which types of help provide the minimal amount of assistance needed. The least intrusive prompt is the one that gives the smallest amount of help while still guiding the client toward the correct response. Gestural prompts, like pointing, are typically considered less intrusive than verbal prompts, which require processing language, and both are much less intrusive than physical prompts, which involve touch. When teaching, you often start with the least intrusive prompt and move up the hierarchy if needed, or start with a more intrusive prompt and fade down to less intrusive ones. Gestural prompts often provide a subtle cue without lots of language or physical contact. Think of pointing to the trash can when asking someone to throw something away. It's a subtle hint. Here's the tip. Less intrusive prompts give just a little bit of help, allowing the client to do more themselves. Question 25. According to ethical guidelines, an RBT should avoid dual relationships, which means A. Having two different supervisors at the same time. B. Having a professional relationship and a personal relationship, like friendship with a client or their family. C. Working with two different clients during the same session. D. Using two different data collection methods for the same behavior. Answer B. Having a professional relationship and a personal relationship, like friendship with a client or their family. This question addresses professional boundaries, specifically the concept of dual relationships. Ethical guidelines strictly prohibit RBTs and other behavior analysts from having overlapping professional and personal relationships with clients or their families. This means you shouldn't be friends with the client's parents on social media, go to family gatherings, or enter into business relationships with them. This is to protect the client, maintain objectivity, and avoid conflicts of interest. Having two supervisors might be acceptable in some situations. Working with multiple clients is common, and using different data methods depends on the plan. A dual relationship is about mixing professional roles with personal ones. Think of a doctor not being best friends with their patient. It keeps the relationship clear and professional. Here's the takeaway. Keep your relationship with clients and their families strictly professional. Question 26. A graph is used in ABA primarily to A. Decorate the therapy room. B. Visually display the data collected on a client's behavior. C. Confuse parents about the client's progress. D. Replace the need for written session notes. Answer. B. Visually display the data collected on a client's behavior. This question is about the importance of graphs in ABA. Graphs are essential tools because they provide a clear visual representation of the data collected on a behavior or skill over time. Seeing the data on a graph makes it much easier to track progress, identify trends, and determine if an intervention is working. They are not for decoration, confusing anyone, or replacing detailed written notes. Graphs allow supervisors and RBTs to quickly see if a behavior is increasing or decreasing as expected, or if a skill is being learned. Think of a stock market graph showing how a stock's price changes over time. It makes trends easy to spot. Here's the tip. Graphs turn numbers into pictures so you can easily see if things are getting better or worse. Question 27. Your client receives reinforcement on average after every 5 correct responses, but the exact number of responses required changes each time. Sometimes 3, sometimes 7, sometimes 5. This is an example of A. Fixed ratio, FR. B. Variable ratio, VR. C. Fixed interval, FI. D. Variable interval, VI. Answer. B. Variable ratio, VR. This question again tests your understanding of reinforcement schedules, focusing on those based on the number of responses. The key phrases are on average after every 5 correct responses, and the exact number changes each time. This describes a variable ratio, VR, schedule where the number of responses required for reinforcement varies unpredictably around an average number. Fixed ratio, FR, requires a set, predictable number of responses. Interval schedules, phi, VI, are based on time, not response count. VR schedules are known for producing high, consistent rates of behavior. Slot machines are a perfect example. You might win on your first pull, or your 10th, or your 5th, but it averages out over many plays. Here's how to keep it straight. Variable ratio means the number changes, but you know the average. Question 2, acknowledging the average helps differentiate it from random reinforcement, where there isn't even an average target. Question 28. When a client learns to perform a skill in a new environment or with a new person, this is called A. Discrimination. B. Generalization. C. Shaping. D. Prompting. Answer. B. Generalization. This question is about applying learned skills beyond the specific situation where they were taught. Generalization occurs when a behavior or skill learned in one setting or with one person happens in other settings or with other people, or when responding to similar but not identical stimuli. Discrimination is the opposite, responding differently to different stimuli. Shaping is teaching a new behavior through small steps. Prompting is providing help. If a child learns to say hello to their therapist and then starts saying hello to their teacher, parents, and strangers in the store, that's generalization. Teaching for generalization is a crucial part of ABA therapy to make sure skills are useful in the real world. Here's the takeaway. Generalization is when skills spread to new places, people, or things. Question 29. Which of the following is not a continuous measurement method? A. Frequency. B. Duration. C. Latency. D. Partial interval recording. Answer. D. Partial interval recording. This question asks you to identify the measurement method that does not involve recording every single instance of the behavior or its duration/latency every time it occurs. Continuous measurement methods, like frequency, counting every time, duration, timing every time, and latency, timing before every time, capture every occurrence or aspect of the behavior. Discontinuous methods like partial interval recording, whole interval recording, and momentary time sampling only capture the behavior if it occurs within or at specific points during intervals, thus not recording every single instance. Partial interval recording breaks time into intervals and records if the behavior happened at all during the interval, missing many instances that occur outside the interval or for short periods. Here's how to remember. Continuous means you're tracking the behavior every time it happens, while discontinuous means you're only checking sometimes, during / at intervals. Question 30. A motivating operation, MO, is something that A. Signals that reinforcement is available. B. Decreases the future probability of a behavior. C. Makes a reinforcer more or less effective and makes a behavior more or less likely to occur to get that reinforcer. D. Is delivered after a behavior to increase its future probability. Answer. C. Makes a reinforcer more or less effective and makes a behavior more or less likely to occur to get that reinforcer. This question asks about the function of a motivating operation, MO. MOs are things that change the value of a reinforcer and, as a result, change how likely a behavior is to occur to get that reinforcer. They make you want something more or less, which then makes you more or less likely to do the behavior that gets you that thing. Being hungry, an MO, makes food, a reinforcer, more valuable and makes you more likely to seek food. The behavior, being full, makes food less valuable. SD's signal reinforcement is available. Punishers decrease future behavior. Reinforcers increase future behavior after the behavior occurs. MOs work before the behavior by changing motivation. Here's the tip. MOs are all about changing how much you want something, which drives your behavior. Question 31. The most important reason for taking accurate data is to A. Impress your supervisor. B. Prove that you are working hard. C. Track client progress and make informed decisions about treatment. D. Fill up the data sheets. Answer. C. Track client progress and make informed decisions about treatment. This question emphasizes the core purpose of data collection in ABA. Accurate data is not about showing off, proving you're busy, or just filling forms. It's the essential information needed to objectively determine if the interventions are working, if the client is meeting their goals, and if changes need to be made to the treatment plan. Supervisors rely on accurate data to make clinical decisions. Without good data, it's impossible to know if therapy is effective or how to adjust it. Think of a doctor tracking your temperature and symptoms. They use that data to decide if the treatment is working or if they need to try something else. Here's the key. Accurate data is the compass that guides treatment decisions. Question 32. Reinforcement delivered after the first response that occurs after an unpredictable amount of time has passed is what type of reinforcement schedule? A. Fixed ratio, FR. B. Variable ratio, VR. C. Fixed interval, FI. D. Variable interval, VI. Answer. D. Variable interval, VI. This question describes a variable interval, VI, reinforcement schedule. Variable means the time changes unpredictably, and interval means reinforcement is based on time passing, not the number of responses. The first behavior that happens after that unpredictable time period is over gets reinforced. Fixed interval, FI, has predictable time intervals. Ratio schedules, FR, VAR, are based on response count. Checking your email is often on a VI schedule. You might get a new email, reinforcement, after waiting 5 minutes, then 1 minute, then 10 minutes, but you never know exactly when, so you check periodically. VI schedules produce steady, moderate rates of behavior. Here's the tip. Variable interval means the time between reinforcements changes unpredictably. Question 33. If a client bites their hand, and as a result, you provide strong verbal reprimand, and the hand biting increases in the future, the verbal reprimand acted as A. Punisher. B. Reinforcer. C. Extinction. D. SD. Answer B. Reinforcer. This question is a bit tricky because it shows that what seems like punishment, a reprimandee, can actually function as reinforcement if the behavior it follows increases in the future. The definition of reinforcement is anything that follows a behavior and makes that behavior more likely to happen again in similar situations. In this case, the reprimand, even though it was intended to decrease the behavior, actually increased it, likely because it provided attention, which was reinforcing for the client. Punishment decreases behavior. Extinction stops reinforcement. And SD comes before the behavior. Always look at the effect on the future behavior to determine if something was a reinforcer or punisher. Here's the crucial point. Consequences are defined by their effect on future behavior, not by your intention or how they seem on the surface. Question 34. When teaching a new skill, providing less and less assistance over time until the client can perform the skill independently is called A. Prompt dependency. B. Fading. C. Shaping. D. Generalization. Answer B. Fading. This question describes the process of systematically reducing the level of prompting or assistance you provide as the client learns a skill. Fading is gradually removing the prompt until the client can perform the behavior when only the natural cue, the SD, is present. This is essential for the client to become independent. Prompt dependency happens when a client relies too much on prompts. Shaping is reinforcing successive approximations. Generalization is performing the skill in new situations. Fading ensures the client is truly learning the skill, not just learning to respond to your help. Think of learning to ride a bike with training wheels. You gradually raise or remove the training wheels, fading, until you can ride on two wheels independently. Here's the takeaway. Fading is slowly taking away your help so the client can do it on their own. Question 35. Which ethical guideline requires you to protect your client's private information? A. Maintaining competence. B. Professional boundaries. C. Confidentiality. D. Responsible conduct. Answer C. Confidentiality. This question directly addresses the ethical principle of protecting client information. Confidentiality means keeping information about the client, their family, and their therapy private, and only sharing it with authorized individuals, like your supervisor or other team members who need to know, or when legally required, like reporting suspected abuse. Maintaining competence is about your skills. Professional boundaries are about avoiding dual relationships. Responsible conduct is a broad principle of acting professionally. Protecting privacy is a fundamental ethical requirement. Think of a doctor's office or a therapist's office. They have rules to keep your information private. Here's the key. Confidentiality means keeping client information private and safe. Question 36. Collecting data on whether a behavior occurred at the very end of a specific time interval is called A. Partial interval recording. B. Whole interval recording. C. Momentary time sampling. D. Latency. Answer C. Momentary time sampling. This question describes momentary time sampling, MTS. In MTS, you break the session into intervals, but you only check to see if the behavior is happening at the exact moment each interval ends. If it's happening at the beep or when your timer goes off, you mark it. If it happened throughout the interval, but stopped right before the end, you don't mark it for that interval. Partial interval records, if it happened at any point. Whole interval records, if it happened for the entire interval. And latency is time before a behavior starts. MTS is often easier to do while doing other things, but it can underestimate or overestimate the true occurrence of the behavior depending on whether the behavior is usually happening at the end of the interval. Think of glancing at a clock at specific times to see if someone is smiling. You only record it if they are smiling at that exact moment you look. Here's the tip. Momentary time sampling means you only check for the behavior at the exact moment the interval is over. Question 37. When you deliver reinforcement every single time a specific behavior occurs, you are using what type of reinforcement schedule? A. Intermittent reinforcement. B. Continuous reinforcement, CRF. C. Ratio reinforcement. D. Interval reinforcement. Answer: B. Continuous reinforcement, CRF. This question describes a continuous reinforcement, CRF, schedule. Continuous means the behavior is reinforced every single time it happens. This schedule is most often used when first teaching a new skill or behavior because it helps the client quickly learn the link between the behavior and the reinforcement. Once the behavior is learned, you typically switch to an intermittent schedule, reinforcing only some instances, to make the behavior more resistant to extinction. Intermittent reinforcement means reinforcing only some occurrences. Ratio schedules are based on counts, interval schedules on time, but CRF is a type of schedule distinct from intermittent ones. Think of training a dog to sit. Initially, you give a treat every time they sit when asked. Here's the takeaway. Continuous reinforcement means reinforcement happens every time the behavior happens. Question 38. What is the primary purpose of a functional assessment, FBA? A. To teach the client new skills. B. To identify the function or purpose of a challenging behavior. C. To punish inappropriate behavior. D. To determine the client's IQ. Answer: B. To identify the function or purpose of a challenging behavior. This question reinforces the core purpose of a functional behavior assessment, FBA. As mentioned before, an FBA is conducted to understand why a challenging behavior is occurring, what purpose it serves for the individual. Behaviors usually happen because they lead to something desirable, like attention or getting an item, or allow the person to avoid something undesirable, like a difficult task. Identifying this function is crucial because interventions are most effective when they address why the behavior is happening. FBAs aren't primarily about teaching new skills, punishing behavior, or assessing intelligence. They are about understanding the reason behind the behavior. Think of figuring out why a car makes a strange noise before trying to fix it. You need to know the cause, function, first. Here's the tip. An FBA is like detective work to find out the payoff or purpose of the challenging behavior. Question 39. You are teaching a client to label pictures. You hold up a picture of a dog and say, dog. Then you wait for the client to say dog. This is an example of A. Verbal prompt. B. Model prompt. C. Physical prompt. D. Gestural prompt. Answer: B. Model prompt. This question describes a specific type of prompt where you show the client what to do or say. Saying the word dog right before the client is expected to say it is providing a vocal model for them to imitate. This is a model prompt. Verbal prompts might be giving a hint. What animal says woof? Physical prompts involve touch, and gestural prompts involve pointing. Modeling provides the client with a direct example of the desired response. Think of showing someone how to do a dance step and asking them to copy you. Here's the takeaway. A model prompt is showing the client exactly what you want them to do or say. Question 40. The ethical principle of do no harm is also known as A. Beneficence. B. Fidelity. C. Non-maleficence. D. Justice. Answer: C. Non-maleficence. This question tests your knowledge of ethical principles, specifically the concept of avoiding harm. In ethical frameworks, non-maleficence means you have an obligation to not cause harm to others. This is a foundational principle in healthcare and therapy. Beneficence is about doing good and promoting welfare. Fidelity is about being trustworthy and loyal. Justice is about fairness and equality. The direct translation or common association for do no harm is non-maleficence. For RBTs, this means ensuring interventions are safe, not using procedures that could be harmful, and prioritizing client safety. Think of the Hippocratic Oath doctors take. First, do no harm. Here's the tip. Non-maleficence is the fancy word for making sure you don't cause harm. Question 41. When should an RBT seek clinical supervision? A. Only when they have a major problem with a client. B. Regularly, as required by the BACB and their employer. C. Only when they need help understanding a data sheet. D. Only when they are new to the job. Answer: B. Regularly, as required by the BACB and their employer. This question is about the requirement for RBTs to receive ongoing supervision. RBTs are required by the Behavior Analyst Certification Board, BACB, and typically by their employers to receive regular clinical supervision from a qualified supervisor, like a BCBA. This supervision is essential for ensuring they are implementing plans correctly, maintain competence, receiving feedback, and addressing any challenges or questions that arise, not just major problems. It's a standard part of the RBT role, ongoing throughout their certification period. Think of a student teacher who needs regular check-ins with their mentor. Supervision is an ongoing learning and quality assurance process. Here's the crucial point. Supervision isn't just for problems or beginners. It's a continuous requirement for RBTs. Question 42. A graph showing the total number of times a behavior has occurred over time is called A. Bar graph. B. Scatter plot. C. Cumulative record. D. Line graph. Answer: C. Cumulative record. This question asks about a specific type of graph used in ABA that shows the total count of a behavior over time. A cumulative record is a line graph where the line never decreases because each point on the line represents the total number of responses recorded up to that point in time. It's excellent for showing overall progress and rate of response. A line graph can show behavior frequency changing over time, but the line can go down. Bar graphs compare discrete sets of data. Scatter plots show relationships between two variables. A cumulative record keeps adding the count, showing the accumulated total. Think of an odometer in a car. It shows the total miles driven, always increasing. Here's the takeaway. A cumulative record piles up the count, always showing the running total. Question 43. If a behavior occurs more often in the presence of a specific stimulus than in its absence, that stimulus is said to have A. Generalization. B. Extinction. C. Stimulus control. D. Spontaneous recovery. Answer: C. Stimulus control. This question is about a key concept in ABA. Stimulus control. Stimulus control is achieved when a behavior is more likely to occur in the presence of a particular stimulus, in SD, than in its absence or in the presence of other stimuli, S deltas. It means the stimulus has gained control over the behavior, signaling when it will likely be reinforced. If a dog only sits when you say sit, the SD, and not when you say other words, sit has stimulus control over the sitting behavior. Generalization is responding similarly to different stimuli. Extinction is stopping reinforcement. Spontaneous recovery is the behavior reappearing after extinction. Stimulus control is about a stimulus reliably triggering a behavior because of past reinforcement history. Here's the tip. When a stimulus tells you when and where to do a behavior, it has stimulus control. Question 44. Using reinforcement to increase the probability of a behavior is A. Only ethical with children. B. A common and effective strategy in ABA. C. Considered a form of punishment. D. Only used for teaching basic skills. Answer: B. A common and effective strategy in ABA. This question addresses the role of reinforcement in ABA. Reinforcement is a fundamental principle and a primary tool used across all areas of ABA therapy, with clients of all ages, and for teaching skills ranging from basic to complex, as well as decreasing problem behaviors by reinforcing alternative behaviors. Using reinforcement is considered an ethical and evidence-based practice for increasing desired behaviors. It is not limited to children, it is the opposite of punishment, and it's used for all types of skills and behaviors. Think of learning anything. You are more likely to repeat actions that lead to positive outcomes. Reinforcement. Here's the takeaway. Reinforcement is a core positive tool in ABA for making desired behaviors happen more often. Question 45. When should an RBT collect baseline data? A. After implementing the intervention. B. Before implementing the intervention. C. Only if the supervisor requests it. D. Continuously throughout the intervention. Answer. B. Before implementing the intervention. This question is about baseline data collection. Baseline data is the data collected before an intervention or teaching procedure is started. Its purpose is to measure the behavior or skills frequency, duration, etc., as it occurs naturally without any specific plan in place. This provides a starting point or comparison to see if the intervention has an effect. You collect baseline data to see where you're starting from, then implement the intervention and continue collecting data to compare against the baseline. You don't collect it after the intervention begins, that's intervention data, only if requested. It's standard practice, or continuously throughout. You transition to intervention data collection. Think of weighing yourself before starting a diet. That first weight is your baseline to see if the diet works. Here's the tip. Baseline data is your starting point, what the behavior looks like before you try to change it. Question 46. If a client engages in a problem behavior, and as a result, they are allowed to escape from a demand, example, doing chores, and the problem behavior increases in the future, this is an example of A. Positive reinforcement. B. Negative reinforcement. C. Positive punishment. D. Negative punishment. Answer. B. Negative reinforcement. This question describes negative reinforcement. Reinforcement increases the future probability of a behavior. Negative reinforcement specifically involves the removal or avoidance of an unpleasant stimulus after the behavior occurs, which makes the behavior more likely in the future. In this case, the unpleasant stimulus is the demand, chores. The behavior is the problem behavior, example, screaming, and the removal of the demand, escaping chores, increases the screaming behavior in the future when a demand is present. Positive reinforcement involves adding a pleasant stimulus. Punishment decreases behavior. Think of hitting the snooze button. Behavior, to stop the annoying alarm sound. Unpleasant stimulus removity. You're more likely to hit snooze again in the future. Here's the takeaway. Negative reinforcement strengthens a behavior by taking away something the person doesn't like. Question 47. The ethical guideline that requires RBTs to use the most effective, science-based procedures available is related to A. Beneficence. B. Fidelity. C. Non-maleficence. D. Responsible conduct. Answer. A. Beneficence. This question is about the ethical principle of doing good and promoting the client's welfare. Beneficence means working for the benefit of others and using interventions that are likely to be effective and improve the client's life. This includes staying current on research and using evidence-based practices, aiming for the best possible outcomes for the client. Non-maleficence is about avoiding harm. Fidelity is about trustworthiness. Responsible conduct is broad professional behavior. Choosing the most effective, scientifically validated treatments aligns with the goal of doing the most good for the client. Think of a doctor recommending a treatment that has been proven by research to work best for a specific illness. Here's the tip. Beneficence is all about doing what's best for the client, which means using methods that actually work. Question 48. Which of the following is an example of permanent product measurement? A. Counting how many times a child talks during circle time. B. Timing how long a child takes to start a task after the instruction. C. Counting the number of completed math problems on a worksheet. D. Checking if a child is playing appropriately at the end of each interval. Answer: C. Counting the number of completed math problems on a worksheet. This question asks about permanent product measurement. This method involves measuring the results of a behavior after the behavior has happened by looking at the lasting environmental outcome or product. You don't have to be there while the behavior is happening. You can measure the result later. Counting math problems on a worksheet is a perfect example. The completed problems are the permanent product of the behavior, doing math. Counting talks, frequency, timing latency, or using interval recording require you to be present and observing the behavior as it occurs. Think of counting how many toys are put away in a toy box or how many dishes are clean in the drying rack. These are results you can measure later. Here's the tip. Permanent product measurement is measuring the stuff left behind by the behavior. Question 49. You are working with a client who engages in screaming for attention. The BCBA asks you to put screaming on extinction. During the first session, the client screams more often and louder than before. This is likely an example of A. Spontaneous recovery. B. An extinction burst. C. Punishment. D. Successful extinction. Answer: B. An extinction burst. This question presents a classic scenario describing an extinction burst, when you stop reinforcing a behavior, screaming that was getting attention. It's very common for the behavior to temporarily get worse, happen more often, more intensely, or with variations, like screaming louder or adding crying. Before it starts to decrease, this is the extinction burst. Spontaneous recovery happens after the behavior has already decreased. Punishment decreases behavior. Successful extinction means the behavior has decreased significantly or stopped. The initial increase is the burst. Think of trying to get a vending machine to work after it takes your money and gives no snack. You hit the buttons repeatedly and harder, the burst, before giving up. Here's the key. If the behavior gets worse right after you start extinction, it's probably an extinction burst. Question 50. An RBT is working on a skill acquisition program. The program states to use least to most prompting. This means the RBT should start with A. The most intrusive prompt and fade to less intrusive. B. The least intrusive prompt and move to more intrusive if needed. C. Only use physical prompts. D. Only use verbal prompts. Answer: B. The least intrusive prompt and move to more intrusive if needed. This question is about a common prompting strategy called least to most prompting. This method involves starting with the prompt that provides the least amount of help, like a gestural or verbal prompt, and only increasing to more intrusive prompts, like physical, if the client doesn't respond or responds incorrectly. The goal is to give the client the opportunity to perform the behavior with minimal help first, promoting independence. Most to least prompting starts with the most intrusive and fades down. Least to most goes up the hierarchy as needed. It doesn't mean using only one type of prompt. Think of helping someone find something. You might first just point, least intrusive, then maybe give verbal directions, and only if they still can't find it, you might physically guide them, most intrusive. Here's the tip. Least to most prompting starts small with help and only gives more if needed. Question 51. When you present a stimulus, like a demand or an item, to evoke a specific response, this is called A. Consequence. B. Behavior. C. Antecedent. D. Reinforcement. Answer: C. Antecedent. This question asks about what comes before a behavior in the ABC model. Antecedent, behavior, consequence. The antecedent is the stimulus or event that occurs immediately before the behavior of interest. Giving an instruction, touch red, presenting a task, or showing an item are all examples of antecedents that set the occasion for a client to respond. The behavior is the action the client does, and the consequence is what happens immediately after the behavior. Antecedents help us understand what triggers a behavior. Think of the phone ringing, antecedent, greater than you answer it. Behavior, greater than you talk to someone. Consequence, here's the takeaway. The antecedent is the trigger, or what happens right before the behavior. Question 52. It is acceptable for an RBT to accept gifts from a client's family if A. The gift is small and inexpensive. B. It's a holiday or special occasion. C. The supervisor approves it. D. It is generally not acceptable due to ethical boundaries. Answer D. It is generally not acceptable due to ethical boundaries. This question addresses the ethical guideline regarding professional boundaries and accepting gifts. While there can sometimes be gray areas and specific company policies, the general ethical standard in behavior analysis is to avoid accepting gifts from clients or their families. Accepting gifts can blur the professional boundary, create a feeling of obligation, or lead to conflicts of interest. It's best practice to politely decline gifts and maintain a professional relationship. Even small or inexpensive gifts can sometimes be inappropriate. Always check with your supervisor and err on the side of maintaining professional distance. Think of most professional service providers. Accepting personal gifts is usually discouraged. Here's the key point. To keep things professional and ethical, it's generally best to avoid accepting gifts from clients or their families. Question 53. Which type of graph is best used to show how a behavior changes over time, particularly with intervention implemented? A. Bar graph. B. Scatter plot. C. Cumulative record. D. Line graph. Answer D. Line graph. This question asks which type of graph is most suitable for showing trends in behavior data over consecutive points in time, especially when comparing data points across baseline and intervention phases. A line graph is the standard graph used in ABA, often specifically called a cumulative record if showing total occurrences, but a general line graph is best for showing change over time with phase changes marked E. Line graphs are excellent for visualizing trends, acceleration, deceleration, and comparing data across different conditions, like before and after intervention. Bar graphs compare different items or conditions. Scatter plots show relationships between two variables. A cumulative record only ever goes up. A standard line graph with points connected is the best way to see how a behavior's frequency, duration, etc. changes day to day or session to session. Think of a graph showing a child's height over the years. A line graph clearly shows the growth trend. Here's the tip. Line graphs are your go-to for seeing how a behavior is changing over time. Question 54. Reinforcing the first instance of a behavior after a fixed, predictable amount of time has passed is what type of reinforcement schedule? A. Fixed ratio, FR. B. Variable ratio, VR. C. Fixed interval, FI. D. Variable interval, VI. Answer C. Fixed interval, FI. This question revisits interval schedules. The key terms are first instance of a behavior, fixed predictable amount of time has passed. This defines a fixed interval, FI, schedule. Fixed means predictable, and interval means time-based. Ratio schedules are based on response count. Variable means unpredictable. On an FI schedule, the behavior is reinforced the first time it occurs after the set time period is over. An example is checking your mailbox. You might check more frequently as the time approaches when the mail usually arrives, the end of the fixed interval. And the first time you check after it's delivered gets you the mail. Reinforcement. Here's the reminder. Fixed interval means time-based, and the timing is steady and known. Question 55. If a behavior occurs and a pleasant stimulus is added immediately after the behavior, and the behavior increases in the future, this is an example of A. Positive reinforcement. B. Negative reinforcement. C. Positive punishment. D. Negative punishment. Answer A. Positive reinforcement. This question describes positive reinforcement. Reinforcement increases the future probability of a behavior. Positive reinforcement specifically involves the addition of a stimulus after the behavior occurs. The stimulus is called a positive reinforcer. If a child says cookie, behavior, and you give them a cookie, pleasant stimulus added, and they say cookie more often in the future, the cookie acted as a positive reinforcer. Negative reinforcement involves removing an unpleasant stimulus. Punishment decreases behavior. Positive here means adding something, not that it's necessarily good, though it's usually something the person likes. Think of getting a sticker. Pleasant stimulus added. For cleaning your room, behavior. You're more likely to clean your room again. Here's the takeaway. Positive reinforcement adds something good to make the behavior happen more. Question 56. Implementing a procedure where you provide reinforcement for any behavior except the target challenging behavior for a specific period of time is called A. Differential reinforcement of alternative behavior, DRA. B. Differential reinforcement of other behavior, DDRO. C. Extinction. D. Punishment. Answer: B. Differential reinforcement of other behavior, DDRO. This question describes differential reinforcement of other behavior, DDRO. In DDRO, you set a timer, and if the target challenging behavior does not occur at all during that interval, you reinforce the client for whatever other behavior they were doing, or simply for the absence of the problem behavior. If the behavior does occur during the interval, you reset the timer and do not provide the DRA reinforcement for that interval. DRA reinforces a specific alternative behavior. DRO reinforces the absence of the problem behavior by reinforcing anything else that happens during the interval. Extinction stops reinforcement for the problem behavior, and punishment decreases behavior. The key with DRO is reinforcing any behavior as long as the problem behavior is not happening. Think of giving a child praise every 10 minutes they don't whine. You reinforce silence or whatever they are doing instead of whining. Here's the tip. DRO reinforces the absence of the behavior you don't want. Question 57. What is the primary purpose of conducting a preference assessment? A. To punish unwanted behaviors. B. To identify potential reinforcers for a client. C. To teach the client new skills. D. To measure the frequency of a behavior. Answer: B. To identify potential reinforcers for a client. This question defines the main goal of a preference assessment, similar to the example question, but phrased slightly differently. A preference assessment is a systematic way to figure out what items, activities, or social interactions a client likes and might be motivated to work for. These preferred items can then be used as potential reinforcers to increase desired behaviors or teach new skills. Preference assessments are not for punishing behavior, teaching skills directly, though they inform teaching, or measuring behavior frequency. They are all about discovering what the client finds rewarding. Think of seeing what snacks, toys, or games a child enjoys most. Here's the easy way to remember. Preference assessments find out what makes the client tick, so you can use those things as rewards. Question 58. When should you use most to least prompting? A. When teaching a brand new difficult skill. B. When the client has a history of prompt dependency. C. When the client learns very quickly. D. When you are fading prompts. Answer: A. When teaching a brand new difficult skill. This question is about choosing an appropriate prompting strategy. Most to least prompting involves starting with the prompt that provides the most assistance, like full physical, and gradually fading to less intrusive prompts as the client becomes more independent. This method is often used when teaching completely new or challenging skills, especially if the client has difficulty learning or imitating, because it helps them perform the skill correctly from the beginning, preventing errors. Least to most is used when you want to give the client more opportunity to respond independently first. Prompt dependency can sometimes be a risk with most to least if fading isn't done effectively, but it's chosen initially for efficiency in teaching difficult skills. Think of teaching someone a complex sequence of movements. You might physically guide them through the whole thing first, most to least, before having them try it with less help. Here's the tip. Use most to least when the skill is hard, and you need to ensure the client gets it right from the start. Question 59. if a behavior occurs and an unpleasant stimulus is removed immediately after the behavior, and the behavior increases in the future. This is an example of A. Positive reinforcement, B. Negative reinforcement, C. Positive punishment, D. Negative punishment. Answer: B. Negative reinforcement. This question describes negative reinforcement, again, emphasizing the removal of an unpleasant stimulus. Just like question 46, reinforcement increases future behavior. Negative reinforcement specifically involves the subtraction or avoidance of something aversive, unpleasant, after the behavior, making that behavior more likely. If putting on a seatbelt behavior stops the annoying beeping sound in your car, unpleasant stimulus removed, you are more likely to put on your seatbelt in the future. That's negative reinforcement. Positive reinforcement adds something pleasant. Punishment decreases behavior. Here's the reminder. Negative reinforcement makes a behavior stronger by taking away something bad. Question 60. An RBT's supervisor asks them to take ABC data on a client's hitting behavior. What information should the RBT record? A. Only the consequence of the hitting. B. The antecedent, what happened before, the behavior, the hitting, and the consequence, what happened after. C. Only the frequency of the hitting. D. Their opinion about why the client is hitting. Answer: B. The antecedent, what happened before, the behavior, the hitting, and the consequence, what happened after. This question is about ABC data collection, a common method used in FBAs to understand the function of a behavior. ABC stands for antecedent, behavior, and consequence. When collecting ABC data, you record what happened immediately before the target behavior occurred. Antecedent: a clear, objective description of the behavior itself, behavior, and what happened immediately after the behavior. Consequence: this helps paint a picture of the context surrounding the behavior, providing clues about its function. Recording only the consequence or frequency isn't ABC data, and opinions are subjective and not appropriate data points. Think of documenting a sequence of events, what led up to it, what the event was, and what was the immediate result. Here's the takeaway. ABC data captures the full picture, what happened before, the behavior itself, and what happened right after. Question 61. What is the primary reason for using a token economy system? A. To punish problem behaviors. B. To provide immediate reinforcement for desired behaviors using generalized reinforcers. C. To allow clients to earn privileges without any behavior requirement. D. To replace all other forms of reinforcement. Answer: B. To provide immediate reinforcement for desired behaviors using generalized reinforcers. This question asks about the purpose of a token economy. A token economy is a system where clients earn tokens, like stickers, points, poker chips, for performing desired behaviors. These tokens are called generalized conditioned reinforcers because they aren't reinforcing on their own, but they can be exchanged later for backup reinforcers, like toys, activities, snacks. Token economies are useful because you can deliver a token immediately after the desired behavior, bridging the gap if the backup reinforcer isn't available right away, and tokens are motivating because they can be traded for various things the client likes. They aren't primarily for punishment. Clients have to earn the tokens, and they are usually used in addition to other forms of reinforcement, like praise. Think of earning points for good behavior in a classroom that you can trade for extra free time. Here's the tip. Token economies use little rewards, tokens, that can be swapped for bigger rewards later, helping deliver reinforcement right away. Question 62. If a client's behavior decreases in the future because a stimulus was removed immediately following the behavior, this is an example of A. Positive reinforcement. B. Negative reinforcement. C. Positive punishment. D. Negative punishment. Answer: D. Negative punishment. This question describes negative punishment. Punishment decreases the future probability of a behavior. Negative punishment specifically involves the removal or taking away of a pleasant or desired stimulus after the behavior occurs, which makes the behavior less likely in the future. If a teenager stays out past curfew behavior and has their phone taken away, pleasant stimulus removed, and they are less likely to stay out late in the future, taking the phone away was negative punishment. Positive punishment adds an unpleasant stimulus. Reinforcement increases behavior. Negative here means subtracting or taking something away. Think of taking away a toy when a child hits another child. The toy is removed. Negative. To decrease the hitting. Punishment. Here's the takeaway. Negative punishment takes away something good to make the behavior happen less often. Question 63. When teaching discrete trial training, DTT, what is the typical sequence of events? A. Response greater than SD greater than consequence. B. SD greater than response greater than consequence. C. Consequence greater than SD greater than response. D. Behavior greater than antecedent greater than consequence. Answer B. SD greater than response greater than consequence. This question asks about the standard structure of a discrete trial, a common teaching method in ABA. A discrete trial follows a clear three-part sequence. First, the RBT presents a clear instruction or cue, which is the discriminative stimulus, SD. Second, the client performs the target behavior or response. Third, the RBT provides the consequence, which is typically reinforcement if the response was correct or a correction procedure if it was incorrect. This sequence repeats for each trial. ABC data follows antecedent behavior consequence, but in a teaching context, the SD is the planned antecedent. Think of a teacher asking a specific question, SD, the student answering, response, and the teacher saying, correct, or try again, consequence. Here's the simple order. SD, you say / do something. Greater than response. Client does something. Greater than consequence. Something happens as a result. Question 64. Which ethical guideline emphasizes professional behavior, following laws and regulations, and avoiding fraudulent conduct? A. Maintaining competence. B. Professional boundaries. C. Confidentiality. D. Responsible conduct. Answer D. Responsible conduct. This question refers to the broad ethical principle of responsible conduct. This principle covers behaving professionally, legally, and ethically in all aspects of your work as an RBT. It includes following codes of conduct, employer policies, laws, avoiding dishonesty, fraud, or illegal activities, and generally acting in a way that reflects well on the profession and protects clients. Maintaining competence is about skills. Professional boundaries are about relationships. Confidentiality is about privacy. Responsible conduct is the overarching principle of acting properly and ethically in your professional role. Think of general rules for being a good, trustworthy employee and citizen in your job. Here's the tip. Responsible conduct is about being a good, ethical, and professional RBT in everything you do. Question 65. Collecting data on whether a behavior occurred at any point during an interval tends to overestimate the actual occurrence of the behavior. This is a known characteristic of A. Partial interval recording. B. Whole interval recording. C. Momentary time sampling. D. Duration recording. Answer A. Partial interval recording. This question highlights a potential inaccuracy of a specific discontinuous measurement method. Partial interval recording involves marking an interval if the behavior occurs for even a brief moment within that interval. This can overestimate the actual total time or frequency of the behavior, as you mark the whole interval even if the behavior only happened for a second. For example, if a child flaps their hands for 5 seconds during a 1-minute interval, you mark the whole minute as having the behavior, making it seem like it happened more than it did. Whole interval recording tends to underestimate, as the behavior must occur for the entire interval to be marked. Momentary time sampling can underestimate or overestimate depending on the behavior. Duration is a continuous, usually accurate measure of time. Here's how to remember. Partial interval is generous, even a part of the interval with behavior counts, which can make the behavior look like it happened more than it did. Question 66. When a client is working for a specific reinforcer and they suddenly lose interest in that reinforcer, example, they just ate a big meal and now don't want food, this is likely due to a change in A. SD, discriminative stimulus, B. motivating operation, MO, C. schedule of reinforcement, D. punishment. Answer B. motivating operation, MO. This question is about what influences the effectiveness of a reinforcer. A motivating operation, MO, is something that changes how valuable a reinforcer is at a particular moment and makes behaviors related to getting that reinforcer more or less likely. Hunger is an MO that makes food more reinforcing. Having just eaten a big meal is an abolishing operation, a type of MO that makes food less reinforcing. The SD signals when reinforcement is available. The schedule determines how often or when it's delivered, and punishment decreases behavior. The change in interest is a direct effect of the MO. Think of being thirsty. Water is highly reinforcing. MO makes it valuable. After drinking a full glass, water is less reinforcing. MO makes it less valuable. Here's the tip. If the client suddenly doesn't care about a reinforcer they usually like, check for an MO that made it less valuable, like being full, tired, or having had too much of it recently. Question 67. Which term refers to presenting the opportunity for a client to earn reinforcement contingent on displaying a target behavior? A. Stimulus control. E. Contingency. C. Extinction. D. Generalization. Answer B. Contingency. This question asks about the relationship between a behavior and its consequence, specifically when the consequence depends on the behavior occurring. A contingency is the if-then relationship in ABA. If the behavior occurs, then the consequence will follow. Reinforcement and punishment procedures rely on contingencies, presenting the opportunity to earn reinforcement if the client displays the target behavior is setting up a reinforcement contingency. Stimulus control is when a stimulus signals the contingency. Extinction is breaking a contingency. Generalization is applying behaviors in new situations. The word contingent in ABA almost always refers to this if X behavior, then Y consequence relationship. Think of it like a deal. If you clean your room, behavior. Then you can play video games, reinforcement. That's a contingency. Here's the takeaway. Contingency means the consequence depends on the behavior. Question 68. Maintaining client dignity means A. Making all decisions for the client. B. Treating the client with respect and considering their preferences and choices. C. Only working with clients who have high cognitive abilities. D. Sharing client information freely with anyone who asks. Answer B. Treating the client with respect and considering their preferences and choices. This question is about an important ethical consideration, maintaining client dignity. This means treating the client with respect as an individual, considering their values, preferences, and opinions as much as possible, involving them in decisions about their therapy when appropriate, and respecting their privacy and autonomy. It's about seeing the client as a person with rights and feelings, not just a set of behaviors to be changed. It does not mean making all their decisions, only working with certain clients, or ignoring confidentiality. It's about upholding their inherent worth and right to respectful treatment. Think of how you would want to be treated if you were receiving support or therapy with respect and consideration. Here's the tip. Maintaining dignity is about treating the client with respect and valuing them as a person. Question 69. The definition of a behavior should be objective, clear, and complete. Objective means A. It includes your opinion about why the behavior happens. B. It is measurable and observable. C. It describes how you plan to change the behavior. D. It is approved by the client's family. Answer B. It is measurable and observable. This question asks about the qualities of a good behavior definition, specifically focusing on objective. An objective definition means it is based on things you can directly see and measure, not on subjective interpretations, feelings, or opinions. A good definition describes the behavior in such a way that two different people observing at the same time would agree on whether it happened or not because it's based on observable actions. Including opinions makes it subjective. Describing how to change the behavior is part of the plan, not the definition. Family input is valuable, but doesn't define objective. Think of defining running. You describe specific actions like moving legs rapidly, with periods where both feet are off the ground, not moving because they are happy. Here's the takeaway. An objective definition is like a video recording, just the facts of what happened, not your thoughts about it. Question 70. Reinforcing the first instance of a behavior after an average of 10 minutes has passed, but the exact time varies, sometimes 8 minutes, sometimes 12 minutes, etc., is an example of A. Fixed ratio, FR. B. Variable ratio, VR. C. Fixed interval, FI. D. Variable interval, VI. Answer D. Variable interval, VI. This question is another check on interval schedules. The key phrases are first instance, average of 10 minutes, and exact time varies. This fits the description of a variable interval, VI. Schedule with an average interval of 10 minutes. Variable means unpredictable, and interval means time-based. Ratio schedules are based on response count. Fixed means predictable. The behavior is reinforced the first time it occurs after the unpredictable time interval is up. Checking the mail or waiting for a bus are real-world examples that are often on VI schedules. Here's the reminder. Variable interval means the time changes unpredictably, but you might know the average time. Question 71. If a behavior occurs and a pleasant stimulus is removed immediately following the behavior, and the behavior decreases in the future, this is an example of A. Positive reinforcement. B. Negative reinforcement. C. Positive punishment. D. Negative punishment. Answer D. Negative punishment. This question repeats the definition of negative punishment, highlighting the removal of something pleasant and a resulting decrease in the behavior. Punishment makes behavior less likely. Negative means taking something away. If a child throws a toy, behavior, and gets their tablet taken away, pleasant stimulus removedi, and they throw toys less often in the future, taking the tablet away was negative punishment. Positive reinforcement adds something pleasant to increase behavior. Negative reinforcement removes something unpleasant to increase behavior. Positive punishment adds something unpleasant to decrease behavior. The effect on future behavior, decrease, combined with the action, removing stimulus, tells you it's negative punishment. Here's the tip. Negative punishment is like taking away a privilege to make the behavior stop happening. Question 72. A skill acquisition plan should include A. A list of problem behaviors. B. Baseline data, a clear goal, the teaching procedure, and data collection method. C. Only the reinforcers to be used. D. Information about the client's family history. Answer. B. Baseline data, a clear goal, the teaching procedure, and data collection method. This question asks about the essential components of a skill acquisition plan, which is the document guiding the teaching of a new skill. A good skill acquisition plan outlines the current level of the skill, baseline data, what the client is expected to achieve, clear goal, the specific steps and prompts the RBT should use to teach the skill, teaching procedure, and how the RBT will measure the client's progress, data collection method. It might also include prompt hierarchies, mastery criteria, and generalization plans. It's not primarily about problem behaviors, that's a behavior reduction plan, just a list of reinforcers or family history. Though relevant background info might be in the client's file. The plan tells you what to teach, how to teach it, and how to track progress. Think of a recipe for learning. It gives you the starting ingredients, baseline, what you're trying to bake, goal, the steps, procedure, and how to measure if it turned out right, data. Here's the takeaway. A skill plan is your step-by-step guide for teaching, including how to measure success. Question 73. If a client engages in a problem behavior and as a result, they are given an unpleasant task to complete, example, cleaning up the mess they made, and the problem behavior decreases in the future, this is an example of A. Positive reinforcement, B. Negative reinforcement, C. Positive punishment, D. Negative punishment. Answer C. Positive punishment. This question describes positive punishment. Punishment makes a behavior less likely in the future. Positive punishment involves the addition of an unpleasant or aversive stimulus after the behavior, which makes the behavior less likely to occur again. In this case, the unpleasant stimulus is the difficult task, cleaning. The behavior is the problem behavior, making a mess, and the addition of the cleaning task makes the mess-making behavior less likely in the future. Negative punishment takes away a pleasant stimulus. Reinforcement increases behavior. Positive here means adding something, in this case, adding something the client finds unpleasant. Think of getting a speeding ticket. Unpleasant stimulus added for speeding, behavior. You're less likely to speed in the future. Here's the tip. Positive punishment adds something bad to make the behavior happen less often. Question 74. You are collecting data on a client's hand flapping. You watch the client for a 10-minute period and count every single time their hands flap. Which measurement method are you using? A. Frequency, or count. B. Duration. C. Latency. D. Whole interval recording. Answer A. Frequency, or count. This question describes counting the number of times a behavior occurs within a specific observation period. When you count every single time a behavior happens, you are measuring its frequency, also known as count. Duration is how long it lasts. Latency is the time before it starts. Whole interval recording is a discontinuous method where you check if it happened for the entire interval. Frequency is a basic continuous measurement of how many times a behavior happens. Think of counting how many times someone says during a presentation. Here's the takeaway. Frequency is simply tallying up how many times the behavior happens. Question 75. When observing a client, you should describe the behavior in a way that is A. Interpreted by you based on how the client feels. B. Clear and observable by anyone watching. C. Only understandable to your supervisor. D. Focused on labels like aggressive or non-compliant. Answer B. Clear and observable by anyone watching. This question reinforces the importance of objective and clear behavior descriptions, which is critical for accurate data collection and communication among the team. A behavior description should be so clear and specific that another person reading it would know exactly what to look for and could agree with you if the behavior occurred. It should describe the actions you see and hear, not your interpretation of feelings or internal states. Labels like aggressive or non-compliant are subjective and don't describe the specific behavior. Example, hit open hand to therapist's arm is objective. The description needs to be understandable to anyone on the team, not just the supervisor. Think of writing instructions for someone else to follow exactly. You need to be very precise about the actions. Here's the main point. Describe the behavior like a camera would record it, just the observable actions.